program is proudly brought to you by Datec PNG Limited.
In this session of Infocus, we are joined by Janet Sios, co-owner of Paradise Private Hospital, and Marco Venditti, documentary filmmaker. We feature discussions on the journey of the Paradise Private Hospital and how it was captured in the Life in the Ward docu-series. Janet Sios and Marco Venditti, thank you for joining us.
Thank you so much for having us in your program.
Now, firstly, Janet, could you give us a bit of background of the Paradise Hospital?
Yeah, so Paradise Private Hospital has been in operation for about 65 years, older than the country. This August will be 66 years. It started off around about 1960, where Dr. Shirley was up here as the wife of one of the administration manager of works at that time. And she came up here and she didn't have much to do, so she set up a clinic, small clinic in the first area of the current facility we've got. And then after that, about 5 years later, Dr. Alan Hutchinson took it over, and he ran it for another sort of 10 years. And then it was on sale, and Dr. Mola bought it in 1979. And then he ran it for a little while after that, and then in 1984, it became the first ever private hospital in Papua New Guinea in 1984, but in 1960, when Dr. Shirley started it, it was the first ever clinic. So a few first milestones for the hospital since. First clinic, first hospital, private hospital. And then Dr. Mola got in my husband, Dr. Robin Sios, and Dr. Lam, a partnership of the three of them for about 25 years. They operated the hospital, and they actually built it up from primary care to secondary care at those times that they were together. And then Robin and I, under our shareholders agreement, we had the first right of refusal, and so we were given the option to buy the two of them off, and we did that in 2014, successfully secured a loan with Westpac and funded the two of them off. And then since then, it's been a 12-year journey to where we are today. I'd say that since we both took it over, decision-making was much easier. A vision of my husband to continue the work the three of them started and continue to be there to build up the facility to a level where we could be able to provide health services for our Papua New Guineans, so they don't have to travel overseas to access basic things that they could do here first in this country. So I would say a majority of the progress or the improvement of the facility, including putting the right equipments to build it up to a 40-bed capacity, has been in the last 12 years, mainly under Robin and I. Building our staff. In the last sort of few years, we've also gone digitized with our processes. So a lot has been achieved in 12 years.
Now, Janet, there is a prevailing perception that private hospitals operate primarily for profit and not necessarily for affordable healthcare service in Papua New Guinea. What is your response to that?
I would say that worldwide, private hospital is always there to provide services to our people, those that can afford it. And if you look at Papua New Guinea, we are no different. Private sector is there, as I see it, is to support the public health and the government in addressing our health services in the country. We are there as an alternative for people who can be able to pay our services and get that quality service that they need for their families. And so to respond to such a response is really about how can you make our services be affordable to our Papua New Guineans. Yes, we are private. Yes, we are not funded by anyone else, not even the government. We have to raise that money through the services to fund the doctors, the nurses, the operating costs, and many of our costs to allow the organizations to operate. But ultimately, it's about the service that we provide to our people. as an alternative to the current government-run hospital, we give people option to come and access healthcare with us in private sector.
Now, drawing from your life in the series, Docu-Series, how would you describe the prevalence of lifestyle diseases in Papua New Guinea?
Wow. Well, I wish I was a doctor to answer that, but over these years, I must say, I picked up a lot of information around healthcare, obviously working with Janet, working with the doctors at the hospital. And my perception on the issue is that lifestyle diseases became at one point the biggest threat, healthcare, health issues in PNG, and it sort of came at a moment where doctors and maybe the health facilities were not ready for it. And that had to do with, we were talking about it before, the change of lifestyle. You know, Papua New Guineans that normally live in rural areas, they conduct a much healthier lifestyle, they're eating garden food, they're exercising, they're swimming, they're running, they're walking. All of a sudden, you know, Papua New Guinea lived in rural areas now, in urban areas more and more, and the availability to good food is unfortunately not as it was before. So a lot of people end up eating processed food and sodas and all that sort of little exercise and so on. So while we were filming this series of documentaries at one point, talking to Dr. Seals, we realized that there was a change and the lifestyle diseases was becoming the biggest threat. And Dr. Seals wanted to contribute to that, also because himself is suffering from it, you know, his diabetes. So we decided at one point that we wanted to do an episode that we were really looking into that story. And we decided to travel back to the province and the village where Dr. Seals was born in New Ireland. That was an amazing trip. But along that trip, we also realized that lifestyle diseases was affecting himself, his family, but the wider community. So many people in the village were suffering from the same problematic. So I think it's a big issue. I'm glad as a filmmaker and a documentary filmmaker that we sort of dug into that issue, sort of bring it forward and put it on the table for a bigger discussion on the issue. And I think the hospital, Paradise, is very concerned about that. Yeah. They know that this is an issue. Yeah. They want to help the community also when it comes to prevention. Yeah. Because the good thing about lifestyle diseases, you can do something about it. You know, if you do change certain things, if you take care of your nutrition, if you exercise, if you control your diet, and if you monitor yourself regularly, it should not be a death sentence. It becomes a death sentence when you're not aware of it, and unfortunately, it does happen quite a lot.
Yeah, I think in the last sort of 40. We've been in operation for 40 years, Robin and I with Dr. Mola. You've seen the change in lifestyle diseases. Initially, they used to look at only malaria, TB, and the basic primary health issues. Now, it's more and more towards lifestyle diseases, diabetic, strokes, heart problems, kidney and all of this. And so it's really about how we live our lives. We smoking more, we going and drinking more, and we're not exercising, and we're not eating balanced diet. And those contribute to these kind of diseases. And so in the hospital, in the last 20 years, we're seeing more and more of lifestyle diseases affecting our people.
I would imagine there's a rigorous data compilation program that you have within the hospital?
Yes. We have data that's available through the current system that we've installed 3 years now. So we can trace diseases that are coming to the hospital. Yeah, we can do that.
Now, Janet, in your view, how can private hospitals best complement public hospitals?
I believe so much that health is everyone's business. Health is government and private sector need to work together to provide the best health care for our people. Our people deserve that. And we have an established MOU with the POMGEN, and we have a many good relationship with the Department of Health. We work together for the good of our people, advancing health in the country. So through that MOU, we have undertaken training between the two of us. If the equipments over there don't work, they can come and access ours. Or if we have need for higher care over there, we send our patients over there. So we support each other through that MOU. And that's a classic example of how partnerships should be established. We'd like to work with a lot of the PHAs as well within the province here and any others that would like to partner with us. It's really about all of us coming together to serve our people, to provide the best healthcare for our people.
Now, Janet, you touched on digital technology currently incorporated in your healthcare. Could you tell us about that?
Well. One of our episodes that we produced, the last one,
True.
right? We featured digital health.
The transition, yeah.
It's been 3 years, 3 years or more now. We embarked on digitization and transformation of our organization. We established a hospital management system with the help of a group in Melbourne, DC2. And they've installed it. It's working perfectly fine. It's mainly to manage all of our medical processes and how our doctors can use it to better serve.
Are there plans to expand your services to other provinces as well?
Maybe not so much the provinces, but we do have a plan right now on hand to be able to build a little bit more expansion of our facility where we are to extend our services. We've had 10 beds in the labor ward for the last 65 years. We'd like to offer another 20 or 30 beds in the new hospital if we could, for all the mothers throughout Papua New Guinea. Some mothers come from provinces to deliver at our facilities, so we'd like to look at Port Moresby expansion as an immediate plan. But going to the provinces, we've always thought about it. We'd like to expand to the provinces, but through telehealth, we will look at how we can roll out to the provinces.
Now, drawing to the Docu-Series, Life in the Ward series, how did this project come about?
Well, that's a very interesting question, and it's an interesting partnership, a hospital and a filmmaker. Doesn't happen very often, I must say. I think it's a one of its kind, really, of a kind. It started when I had a child in Papua New Guinea, and I was thinking, where is she going to be born? So I decided that the Paradise, I heard from the community that the Paradise Hospital was a good middle ground, that the prices were reasonable, that the service was good. I was just basically a client, right? So, and I went there and I liked it. I liked the energy, I liked the atmosphere, the midwives, the nurses. There was a good feeling, I felt it was like a little village, right? And they say that it takes a village to grow a child in PNG. So I thought maybe this would be a good place to have a child and to have my child being born. And while this was happening, being a filmmaker, I became quite curious in the scientific and story, meaning what happened to the mother when it's pregnant and what happened to a child, a fetus that grows inside the mother's womb. And I thought, this could be making actually a good documentary where I'm going to film the process, and I'm trying to understand by having a number of interviews within the hospital with the senior obstetrician, Dr. Paiva, that he could explain to me, first of all, as a father, and then potentially to the people that will watch the documentary, a bit better the process, because I realized that especially men in PNG, they're quite distant when it comes to reproduction. It's a woman's story. They're supportive, they're strong, but they're a little bit in the background. They don't get involved. Even the Pom Gen, men cannot go inside the women's ward. It's like there is a separation, and I thought I don't like that. I wanted to sort of get as close as possible. So as a filmmaker, I said, I want to film this process. And when I mentioned that to Dr. Seals and to Janet, they're so smart, and they said, yeah, that's a good story, please do it. And then that was it. That's how we started it. And then while we were filming all of that, it happened that the COVID pandemic came about. There was like a number of things, and we realized that together we could tell interesting stories in the space of healthcare. Me as a filmmaker and you as a private hospital, and the rest is history.
Because there was a lot of confusion at that time during the COVID, right? What are the doctors saying?
My goodness.
What is everyone saying? Should we take it or not take the vaccination? It was so confusing. And so we decided to get Dr. Mola to come out and speak and encourage people to go and take the vaccination to protect themselves. So that's how it all started now to become a series of documentary. But the biggest decision that Robin and I made at that time, we didn't know anything about all of this, but we said to Mako, we have not really put back to the community in Papua New Guinea in any way to bring awareness of what doctors should be talking about, to educate people about diseases. And so this is our way of putting back to the community and to the Papua New Guineans that we've produced 10 documentaries on malaria, TB, rural health, birthing,
infectious diseases,
all kinds of topic of health. They have been going for 6 years with him. And so we've produced 10. We thought we'll stop at 10, but Dr. Mola said one more, so we're producing one more. And so it's our way of putting back education. Our people need to be educated that they need to take control of their health. Most countries you see, they are going to the hospitals to pre-check first so that they could know some complication, they could manage it. But for us, we stay at home until we're suffering. Then by the time you come, it's late already.
True.
Especially with cancer, you know. So the message to Papua New Guineans is try to put aside some money and do a proper check, which is full blood, so you could address all issues, and the doctor will tell you that your cholesterol is high, you're likely to lead to complications. Your sugar levels are high, your blood pressure is high. And so this is the message to our Papua New Guineans through what we are doing through the 10 documentaries we've produced with Film Bro, that yes, the message is take care of your health. Your health is your wealth.
Yeah, I think it's a good point. If I can add to that, in the sense that I think we're all scared of doctors. I think it's a worldwide phenomenon, and like everybody wants to stay away from medical facilities. Everybody wants to stay away from diseases. But the reality is that we all at one point will need that. And I think we need to change that perception of hospital being a place that you don't want to go. It's actually the other way around. We should really think that medical facilities are there to help us. And therefore we should really look for having a good relationship with medical facilities where you go and have regular check. You know, prevention is always say better than cure, right? And we all terrible patients. We all waiting, you know, home, hoping that things will go away. Sometimes they don't. So it's good to know that you have a partner in this city that is a Paradise Private Hospital that is welcoming. You know, when you enter the Paradise Private Hospital, there is a feeling that it's almost like a family run, and you know there is no hostility, and then the lines are not too long, the prices are reasonable, the doctors are good, and there is a good energy, and it's sort of bringing the community together. And I think I felt that this was an important aspect of living in Port Moresby as well. I wanted to show that as well. And obviously having Dr. Mola, Professor Mola, that is such a luminary, he has formed so many doctors in Papua New Guinea. So having him as a lead figure from a medical point of view for me was an eye-opener, because through him working in the public sector, I understood so much about what is going on in PNG on some of those issues that you mentioned, TB, malaria, infectious diseases, lifestyle diseases. And then when we traveled to understand what is happening in rural areas, it was shocking to understand, you know, the difficulties the Papua New Guineans face by people living in rural areas miles away from any district hospitals or health centers or health posts, if any of them are still intact. So it's a difficult story, PNG. It's a difficult story when it comes to healthcare. But so having a partner like them, for me, has been a blessing, really. Yeah.
How important was it for you to use personal stories? I noticed that throughout your docu-series you had individuals share the experience.
Yeah, thank you for asking that. We made a conscious decision that we could not just tell a story that it was only on science, only on medical science. We knew that in each episode we needed to feature a personal story, because through a human story, a viewer can feel much closer to the issue. We can talk for hours about TB from a medical point of view, interviewing doctors and so on, and very valuable, sure. But as an audience, you still feel a little bit of distance. But if you do follow the story of a person within that, then all of a sudden the documentary has a different level of engagement, because you might look at that person, you think, oh my God, that could be my sister, it could be my brother, it could be my father or my mother. All of a sudden you connect. So we always made an effort to have a personal story, a human story. And Dr. Mola, Professor Mola, is fantastic for that, because his relationship with the patient is incredible. He can really engage with them, to gain their trust so easily. So it wasn't that difficult to find this personal...
And I remember that mother, he sent the mother down from Pomjan down to us. And for us to manage the mother. And she ended up having some complications too.
Many complications.
And so, you know, the public health is there, and they are servicing bulk of Papua New Guinea. You know, most of everyone go to the public health. And so, you know, private health really complements. We take care of the workers, the corporates, the people who their employers can look after them through insurances and medical covers, whereas the general population are going to Pomjan.
Now, Marco, how did you decide on the documentary's tone or theme to focus? Did you want it to be investigative or probably patient-focused or a human interest story, as you mentioned?
Yeah, frankly, I don't have an agenda. I really don't know, in the sense that every episode is so different, and I can't really think before time of what is going to be. We might decide together on the subject matter vaguely and say, okay, that's going to be the topic for this episode. But then we get on the road, and life always surprises us, and I'm really happy that it does, because that leaves us now the freedom to choose at the editing stage what to do with it, because we'll come back with hours and hours of material. I think earlier on you were asking, how many hours you filmed? I don't know, days and days of footage. So we get back on the editing and room, and we scratch our head, you know, how am I going to tell this story and so on. And really, purposely, I don't go out there with an agenda. I want to sort of feel free to tackle the story, talking to people, and see how we're going to put this together later on. Because you cannot script life, you know. Life is always going to surprise you, and likely so that it does. And I remember driving with Dr. Sears on his car, on the small little pathway that took to the village, and as we're driving, Dr. Sears sees two butterflies out of the window, and he says, "Oh, look! Those are two butterflies that they always are hanging around here, and one is blue and one is brown, and they're big butterflies. You know, PNG is famous for butterflies, right?" And he says, "Oh, these two, they always go together." And then on the editing stage, when we were back, obviously it was Dr. Sears and Janet together, and we put that story there, and you know, she was so surprised with it.
Yeah, that was one of those.
So that's to tell you, like, we just go with the story. You know, what
Were you comfortable having your story told through the media?
For us, as the sponsor of the financial sponsor of the programs, we don't tell him how he'll do it. We just guide him of a topic, rural health. Then him and Dr. Mola go out and decide to go to Chimbu, go to Goroka. Where else did you go?
Goroka.
Goroka. So they just go and film whatever is out there, and he puts it all together. So the creativity is all for Marco. We don't tell him anything except guide him.
Yeah, but I think, you know, Dr. Sears and Janet, they're two exceptionally intelligent people, I must say, emotionally speaking as well. And Dr. Sears is also a doctor, obviously. But they have I found that they have this Papua New Guinean values, but with an international sort of take on things. And I think that's what has worked well, you know, in this sort of partnership, you know, because I could tell and I could sense their international experience, but it was built over a Papua New Guinean strength, you know, Papua New Guinean sort of values, you know, what's right and what's wrong. And I felt that right from the beginning. And I think it's a reflection also of the hospital in a way. You know, it's a Papua New Guinean institution, but it has international ambitions, you know, to be on par with
provide the best.
Providing the best, but still having an eye for Papua New Guinean culture, Papua New Guinean values, and Papua New Guinean people. It's a good package, and I think he has worked also in relation to form that partnership, right from the beginning.
On a personal note, you've done several documentaries over the years. Do you feel that there are enough Papua New Guinean stories told through documentaries?
Oh, well, I got fascinated with PNG when I came here precisely because that, in the sense that I realized that PNG has a really interesting story to tell. And not many people spend time in PNG to do that kind of work. Yes, you do have those crews that come from Australia, but you really feel that they're coming on a really tight time schedule. They go out, they film, and off they go. They don't really mingle with the society as much. And I thought when I was here that there was a lot to be done with Papua New Guineans and telling Papua New Guinean story. I work only with Papua New Guineans. Janet knows all my crew are Papua New Guineans because I really want to understand some of the challenges, because let's face it, PNG has challenges as well, but also opportunities. And it's a country that has, the story of PNG hasn't really been told, internationally.
Yeah.
Not many people understand this country. And there are a lot of interesting stories that could be told. So if you ask me, was enough? No, I think much more can be said.
Yeah.
I mean, I remember doing filming when I was working here at EMTV. We did the story on the Faziwazi.
Yeah.
That was an interesting documentary because we went along the Kokoda track
Yeah.
trying to understand the role of the Faziwazi during the Second World War. And it was interesting because we understood that they were not just porters helping the wounded soldier, but they were actually active in the fighting as well. These people were really involved in it as well. I mean, they were supporting of the Australians most of the time of what was going on in those during dramatic years of the Second World War. So I had the privilege to travel and to tackle stories that really get into the core of the nation. I'm now involved in a story with the UNDP about the Bougainville process of independence, so it's a very interesting documentary. I'm lucky in a way that I've been trusted to tackle some very important issues in this country, but there are many more to tell. So I will invite anybody that is a filmmaker to take a look at PNG. And obviously visually it's a stunning place, and it's an easy place to be a filmmaker because Papua New Guineans are very friendly with cameras. I don't think I ever been told in many years that I've been in this country to put the camera down when I go filming. Nobody has ever told me, hey, you put that camera down. It hasn't happened. Papua New Guineans do respond well to that. They like it. They like to be engaged.
Ms. Janet Seals and Mr. Marco Venditti, thank you for joining us.
Thank you.
Thank you so much for having us.
Appreciate it.
Yeah.
Well, viewers, that ends this episode of In Focus. Do join us again next week, Monday, on our regular time slot of 7 p.m. Till then, bye for now.
This program was proudly brought to you by Daytech PNG Limited.